Hi, everyone. I'm Jerlise Diaz with the Record Journal. We're here today with our new weekly segment, Ask the Expert. In partnership with Hartford Healthcare's Midstate Medical Center, Community Health Center, the United Way of Meriden and Wallingford, the Spanish Community of Wallingford, the State of Connecticut, and the Connecticut Department of Public Health. We'll talk about various aspects of the vaccine rollout and have a medical expert answer a weekly question. Today, I'm joined by Dr. Marwan Haddad from Community Health Center. This week's question is the vaccine safe to get for people who have autoimmune diseases and fibromyalgia? If it's safe, will our pain get worse and our flares be worse than normal?
All right, thank you. So before I answer the question, I think it's important to note that we have very little direct evidence, specifically looking at COVID vaccine safety and efficacy in people with rheumatic and musculoskeletal diseases or autoimmune diseases, including fibromyalgia. So the American College of Rheumatology convened a task force of experts to look at the scientific evidence that's available on COVID vaccines, as well as what is known on other vaccines in patients with rheumatologic and autoimmune diseases. Now, these experts developed a guidance for COVID vaccine use in patients with these disorders and for COVID vaccine timing in people who are on immunomodulatory therapies. So, of course, if you have any specific questions about your own circumstances, please have a discussion with your healthcare provider. So the following information comes from this expert guidance. So first, to answer a question perhaps that was not asked here, but is key to consider whenever someone is thinking about the risks and benefits of any treatment, is how important is it that you get the treatment in question, and in this case, the COVID vaccine. So the COVID vaccination is definitely recommended for patients with rheumatologic and autoimmune disorders, particularly since these patients are considered to have higher risk for hospitalization and worse outcomes from COVID itself compared to the general population. The experts acknowledge that there's variability among the different disorders and that there are differences in severity of rheumatologic and autoimmune disease progression that can confer different levels of risk to individuals when it comes to COVID. But in general, the experts agreed that as a group, individuals with rheumatologic and autoimmune disorders are at increased risk of more severe COVID disease. So what do we know about the effectiveness of the vaccine response in patients with rheumatologic and autoimmune disorders? So the experts agree that there may be a blunted response to the vaccine in patients who are on systemic immunomodulatory therapies, and that the vaccine response may not last as long compared to the general population. Now, the reason for this is because such therapies diminish the immune response, as they're supposed to do to help control the autoimmune disease, but as a consequence could also diminish the immune response to the vaccine itself. Now, to what extent, if at all, we do not know. Nevertheless, any protection, whether full or partial, from the vaccine is better than no protection at all. Now, regarding safety of the vaccine, it's not expected to be any less safe than it is for the general population, keeping in mind that these vaccines are meant to elicit a reaction from our bodies, right? So they're highly reactogenic vaccines. And so many people experience injection site pain, headache, muscle aches and pains, fever and chills, and these are good side effects. Just signs that the vaccine is working, allowing the body to mount that immune response we want to protect us from COVID in the future. Now, people who are younger and people after the second shot tend to experience more of these side effects. And we're also seeing people who've had COVID infection in the past having a stronger side effect reaction after the first shot. But remember, these side effects are expected. They occur within the first 1 to 2 days after the vaccine is given and tend to last 1 to 2 days on average. So don't be scared if you experience them. Now, what about a possible flare occurring after receiving the vaccine? There's a theoretical risk that a flare or worsening of the disease could happen after getting vaccinated. Now, we don't have good scientific evidence supporting this risk, other than it being a theoretical. But the benefit of getting vaccinated and being protected from getting COVID outweighs the potential theoretical risk of a flare. And last, in general, for the majority of the medications and the immunomodulatory therapies you may be on for your rheumatologic and autoimmune disorders, no changes need to be made. Timing of the vaccination in relation to the therapies, however, may need to be coordinated. So please check with your healthcare provider on when you should receive your vaccine in relation to your treatments.
Okay, thank you, Marwan Haddad, for joining us today. And thank you all for watching. Tune in next week for our next Ask the Expert. If you have a question you would like answered, leave it in the comments below and we'll add it to our list. Thank you again for our partners for making this possible. Hartford Healthcare's Midstate Medical Center, Community Health Center, the United Way of Meriden Wallingford, the Spanish Community of Wallingford, the State of Connecticut, and the Connecticut Department of Public Health.